So today we are thrilled to welcome Dorota Sienkiewicz for a practitioner perspective on well-being, green economy and equity, a triple win for EU public health. So before introducing our speaker, I want to introduce the context of this event very briefly. So for those who don't know us yet, EUHealthGov is a research network funded by the Universities Association for Contemporary European Studies, and it is coordinated by Dr. Mary Guy from Lancaster University, Dr. Eleanor Brooks from the University of Edinburgh, and myself, Dr. Charlotte Gojewski from City University of London. And this event is part of our network's online quarterly seminar series. Now, for today's event, we are honored and very excited to welcome Dorota Sienkiewicz. Dorota is a senior policy coordinator at EuroHealthNet and leads the policy platform, which provides policy advice and intelligence to the partnership, liaises with EU institutions, their strategic and expert groups, and with public health and social rights stakeholders. She is a public health advocate with almost 15 years of policy experience at European, national, and global level, and with strong interest in health equity, poverty, and social exclusion, early years in vulnerable groups, mental health, gender policy, as well as food systems. Today, Dorota will be talking about climate, health, and equity, and how to approach these complex and interrelated issues in practice, exploring key policy priorities and drawing on recommendations from EuroHealthNet. Just a brief note that this event is being recorded. The format will be roughly 20 minutes presentation, and then we will be opening up for a Q&A with the audience. Okay, Dorota, the floor is yours.
Thank you so much, Charlotte. Yes, before I start sharing my screen, I wanted to thank you, Charlotte, Ellie, and Mary for inviting me, for inviting EuroHealthNet to talk about something to present a practitioner's perspective to your audience. And particularly, I wanted to say thank you for giving me the, free right, I'd say, in choosing a topic. And for this particular reason, I chose the well-being, green economy, and equity as a triple win, indeed, for the EU public health, because I think that's a kind of very relevant topic, perhaps not yet discussed with your network. So yeah, so I just start sharing the screen now. So I hope you can hear me well and you can see the slides. If there are any issues, let me know. Yes. Okay, yes. So, as said, my name is Dorota Sienkiewicz, and I'm a senior policy coordinator at EuroHealthNet. What I'm going to talk about, I'm going to start with telling you a couple of words about EuroHealthNet, who we are, what we do, because I presume not everybody is familiar with the partnership. Then I will go on with talking about what's the problem, why I'm talking about the well-being, green economy, and equity. And why now, and why we think promoting a triple win narrative is a good way to go forward. How this will be done, and here I will present a couple of solutions, among others, the emerging concepts of economy of well-being and within limits solutions. And I will end with taking you through a couple of opportunities at the EU and international level, how this concept and the solutions could be promoted, taken up, and rolled out across Europe. So, EuroHealthNet, who are we? We are a European not-for-profit partnership for health, equity, and well-being. Our core members are national public health institutes and authorities, regional and local health agencies, health promotion agencies, research and practice organizations. And at the moment, as of June 2022, July, I should say, sorry. We have 64 members in 25 European member states. 22 of those are the EU countries. And you can see where we are across Europe on a map here. And for us, really, the focus is to build a healthier future for all by addressing the determinants of health, so the underlying socioeconomic, environmental, political, digital, commercial determinants of health, and reducing inequalities. And we focus on preventing diseases and promoting health by looking for solutions within the healthcare systems, but actually more and increasingly more by looking for solutions from outside of the healthcare systems. So I already mentioned our core mission is to help build a sustainable, fair and inclusive Europe. And we do so by tackling health inequalities between and within European states. And we focus, or we go on with our work by going beyond just focusing on the obvious determinants, the lifestyle risk factors of what makes people healthy or sick. So not just the top of the iceberg, as you can see it here on the slide. So the smoking, alcohol consumption, physical inactivity, unhealthy diets, etc. But actually looking under the surface of the water, going into the policies, practice, research that has an impact on the daily living conditions, such as housing, education, but also working conditions, social support, income, etc. And then from there, trying to dive even deeper, looking at the structures, systems, factors, the economy, how our societies and communities are built, the power and wealth distribution, fiscal policies, the implications of the gender and class inequalities. And as I already mentioned, our members are the national, regional and local stakeholders, and we try to work with them, facilitating the exchange of policy intelligence, doing advocacy together, and that advocacy is evidence-based, always exchanging good practices, collecting data, participating in projects, building capacity of our members, but also the stakeholders in the field to design good policies, good practices, implement them, work across sectors and across different governance levels. But now to the topic of this presentation, the well-being, green economy and equity as a triple win for EU public health. I don't think the statement that I put here as a title will come as a surprise to many, if not at all. Our way of living is unsustainable and unhealthy. Yeah, it makes us ill, and on a grand scale, actually, it kills us. I'd say so. Almost 1 in 3 children in some countries, 1 in 2 children are overweight or obese. The number of people with diabetes in the EU in just about 20 years time rose from almost 70 million to more than 32 million. Air pollution kills 400,000 people prematurely in the EU every year. Climate change impacts health of all of us, particularly vulnerable groups, more. 8% of the EU population, and that's 50 million households, are living in energy poverty. 1 in 4 children live at risk of poverty and social exclusion in the European countries, in one of the richest regions of the world. 1 in 3 children report multiple health complaints, including mental health problems, and suicide is the 2nd leading cause of death among adolescents. So clearly there is something wrong with our societies, and many of those, the reasons for that lay in the environments we live, in the ways we live, move, consume, produce, and the economies we have around us. And it's important to say that these impacts are unequally distributed. So, for example, in regards to climate change, we are all impacted by climate change, but some of us are affected more than others. Children, women, older people, people on low incomes, people living in rural areas or urban dwellings, and so on and so forth. All of that leads to persistent, growing actually health inequalities at the moment. People living in conditions like that. It's actually quite reflective of my hometown and my home country. We have many of places like that. And sorry, I should have added it's Poland, but many places like that in the Central Eastern European countries. But not only, we can see that also in Brussels, where I live at the moment. Many of you live in UK, I presume, France, Germany. There are these pockets of deprivation and disadvantage as well. So what can we do? So by that I mean EuroHealthNet, but also a kind of a coalition of partners, friends across Europe. We are aiming for a triple win. Looking for solutions that simultaneously improve health, mitigate climate change, and help people adapt to the climate change, climate crisis, and benefit everyone. So not just a few, but everyone, including socioeconomically. So how can we achieve this? By enabling and encouraging positive behavior change. So behavior change is an important kind of vehicle for us to achieve the what we want to put on the table vis-a-vis the policymakers and practitioners across Europe. A couple of years back, between 2016 and 2019, EuroHealthNet led a big Horizon 2020 funded project called Inherit. Inherit's aim was to stimulate effective policies, practices, and innovations that simultaneously restore the environment whilst promoting health and specifically health equity in this regard. In other words, practices, innovations, and policies that enable this triple win. The project focused on the areas of on three areas: living, and here we worked on looking into green spaces, energy efficient housing, into areas of moving, so active transport, and areas related to consuming, and here specifically food consumption and production. And basically encouraging us, that is to say citizens across Europe, to modify our current unsustainable lifestyles, which, and I don't think that's going to be a surprise as well when I say it, currently are characterized by a linear model of growth. So take, make, consume, dispose. So that doesn't work. It's inefficient, makes us sick, kills us, as I said. So the project Inherit formulated scenarios for feasible, actionable, a sustainable, circular future. And the project also focused on designing, implementing, and testing intersectoral initiatives to achieve the triple win that we advocated and are advocating for. And importantly, it entered into discussions with citizens, but also businesses alike. So I think that was kind of an interesting way to do that, about how such change could emerge and be implemented and maintained. So at the center of it, you can see it here in the nice colors, is this behavior change wheel, which offered is kind of tool to understand how multiple drivers impact on the environment. Importantly, both here and now, so the current ways of living, moving, and consuming in the places in which we live, but also there and then. So really looking forward and into the broader ecosystem and considering the implications on the future generations. So that was one of the ways we are trying to, or is one of the ways we are trying to work on the well-being, equity, and the green economy, working upstream, building environments that make change easy, accessible, and affordable. So, you know, this mantra of a healthy choice, or a healthy and sustainable choice, an easy or a default choice, so that you don't have to invest too much of your cognitive, I'd say, effort into considering, okay, shall I do that or shall I do that? It's just there, it's affordable, it's available, accessible, and you can act on it, and you know how to. Another way, pretty much related to the inherit model and the behavioral change, is to apply alternative economic models. And here we started looking increasingly a lot into the donut economics model. I hope you are familiar with, originally proposed by Kate Raworth, to encourage a race to the top, you know, striving for more, for better, and for all, achieving the SDGs, and not to the bottom as it is at the moment. So promoting infinite, almost, economic growth that only benefits some, not all, and that exploits people and the planet. So that's here, there's a kind of notion of a life within limits and below the 1.5 degree lifestyles. And the next way, and it's again all very much interrelated, is by fostering intersectoral collaboration and systems thinking. And here I really very much come to the model that we've been promoting at the EU level, and looking into ways how this could enter the EU policymaking narratives, agendas, is the Economy of Wellbeing model and the narrative, which puts forward a positive vision. So not only focuses on the negatives, but on the positives, and unites stakeholders and policymakers. And it pretty much relies on the foundations of well-being, of how we would like our societies to look like, function, and work. The well-being societies that provide the foundations for all members of current and the future generations. That's really very important to stress it all the time. To thrive on a healthy planet, and no matter where they live. So, you know, rural areas, urban areas, ideally no pockets of deprivation and such things. And such societies that we are striving towards would apply bold policies, ambitious policies, and transformative approaches underpinned by a positive vision of health. You know, what we want health to be, and not just diseases, you know, a patchy curative approach to health as it is at the moment. A health that integrates physical, mental, spiritual, and social well-being. It's based on principles of human rights, social and environmental justice, solidarity, gender equity, as you can see here, and intergenerational equity, and peace. And I think that's pretty much comes very relevant in these times when we see the war in Ukraine rolling out across pretty much the rest of Europe as well. And it commits all stakeholders and all governance levels to sustainable low-carbon development, which is grounded in reciprocity, regenerative approaches, and respect among humans and the planet. And also what's important, we are looking in this regard for new indicators of success and the progress beyond the GDP, so the gross domestic product, and that takes account of human and planetary well-being. And it also leads us to, you know, looking for new priorities for public spending, for spending the public budgets, looking into private investments as well that benefit the well-being of the people and the planet. Yep. So with this last point, so looking for investments, how best and smartly spend the budgets that we have. About 2 years ago, we embarked on a work with WHO Office for Investments in Health, the Barcelona office. And we started a process of developing, because it's an organic process, it's being constantly updated, an e-guide for financing health promoting services to offer really investable, attractive and transformative solutions, and how different funds from different levels, from different sectors could be used to fund these triple win solutions. So services that enhance health, equity, and environments. And yeah, the link is provided here in the presentation, which I hope will be shared with the participants, so you can just have a look. It's an online tool, really, with a lot of interesting ways of investing in health, and I think it's pretty much needed because, as hopefully you're also well aware of, out of the quite a lot of money that goes towards financing health, in a way, financing treatment of diseases, only 3% of that is going actually to prevention and health promotion. So a tiny, tiny bit. So I think we can safely say we definitely need a better balance here, and we need more money to be put towards preventing diseases, illnesses, disabilities, and chronic conditions from occurring in the first place, and enhancing health and keeping people healthy simultaneously. So just very quickly, 4 things that the e-guide for financing health promotion does. It provides concrete, in a way, like a kind of case studies, out of the box examples of how those investments in health promotion and disease prevention can be mobilized. So in a way, kind of a little bit advocacy almost toolkit. Secondly, it encourages building alliances, connections, and bridges within and across sectors, because no one actor can connect on its own to make it happen. Thirdly, it asserts the need for systemic change, so really looks forward and not just focuses on like kind of narrow approaches to promoting health, looking into this lifestyle health promotion solutions, which are good on its own, but not enough. Improving systems and kind of bigger picture is important. And with regards to that, strengthening health promotion and disease prevention services as part of sustainable health systems has to be more heard and voiced out there. And lastly, it encourages different stakeholders, policymakers, investors, etc., to go beyond the health sector only and bring about and highlight co-benefits, so those win-win-win solutions. Innovative funds, and here I put a couple of examples that the guide looks into. It's, for example, social outcomes contracting, social impact bonds, health inequalities impact assessments, and also looking into disinvestments. So it doesn't work, get out of it as a matter of priority. Another way we've been trying to work on the well-being, green economy, and equity solutions is to explore the kind of legal aspects of what can be still done within the existing mandate and remit of the EU, and what could possibly be improved. And here, just very quickly, looking into taxation and subsidies, mandatory labeling, for example, on foods and drinks, bans on advertising and marketing, specifically in early years, so directed or targeted to children and vulnerable consumers, and also looking into green and healthy procurement policies, because that's where the leverage is still possible to promote the triple win solutions for health, equity, and kind of green solutions, I'd say. What's also important, we found, is to develop participatory practices and support bottom-up approaches. So that all comes from this Inherit project that we embarked on back in 2015-16, and it really, the legacy of it is really still there, and we see more and more of that coming. So removing legal and structural barriers, providing funding, and facilitate sharing of experiences very locally, on the ground, in schools, in school gardens, at the municipalities level, communities, and then really taking it up and showcasing it vis-a-vis regional, national, and ultimately EU policymakers. Really makes a difference, I have to say. Just illustratively, and it's also included in the e-guide on financing for health promoting services, kind of new interesting initiative, or a set of initiatives, an approach. And I know that the social prescribing is quite well known, I think, in the UK at least, but not in the rest of EU. Hence, we are kind of promoting it a bit out of the Anglophone, I'd say, world. A triple win example via the social and green prescribing. So here we started working also within some research projects on the nature-based solutions that can help to build physical, psychological, and social resilience, and also mitigate effects of stressors. And that came about in the context of the post-pandemic recovery and resilience building. So there's wealth of research and emerging, really saying that contact with nature is important in early years, but also throughout the later lives, well into the old age. And it has to be supported. The investors can be made interested in it, to have it as a package of almost interventions that can be paid for from the health insurance or social insurance schemes in different countries. So we are testing it at the moment to see, does it work? For whom does it work? What could be done better? Who is interested, etc. But it's a kind of nice illustration to bring together primary care centers in a number of European countries, the community and the services that are in community, nature-based and social activities. But obviously for that we need green spaces, we need the environment, we need biodiversity, we need it to be there to actually tap into this potential and the assets of the the environment, clean environment. It's also important to educate a health workforce, but also the non-strictly speaking health workforce to this avail. Upskilling of different professionals, educators who are already in the system, how to take up of those opportunities and solutions is important. And what are the key EU and international policy initiatives that would help deliver this triple win? First and foremost, the European Green Deal that made the EU embark on the green transition to really implement or achieve the commitments that the EU signed up to with the Paris Agreement back in 2015. And it was really a kind of landmark, I have to say, but big deal at the EU level that's composed of many, some say perhaps too many different initiatives and dossiers. But really the idea is to drive, to move the EU towards achieving the zero pollution and climate neutral economy. For us, at least from EuroHealthNet, key dossiers here are the healthy and sustainable food systems, so the farm to fork strategy, and a number of other initiatives come under that as well, such as nutrition labeling, advertising and marketing, and really fight against the NCDs, so the poor diet related NCDs. But also smart, sustainable and healthy mobility and transport. Toxic-free environments is important as well for us. I have to say, really, probably the financing of the green transition, so that it's socially just and doesn't leave those who cannot afford the green transition and live sustainably and healthy, not to be left, further behind. So taking really everybody on board as much as possible. How to finance the triple win? We've been focusing at the very high macroeconomic level. We've been working with the multi-annual financial framework, so the big 7-year long budget for the EU that was proposed back in 2019 and is applicable for the years 2021, 2027. And back then, the Commission and the Member States agreed to dedicate 30% of all the programs financed or funded under this big envelope. They have to be dedicated to supporting climate action. And then 2019, 2020, the pandemic happened, started, and new funds have been added to the MFF, strictly speaking, devoted to the recovery and resilience. Quite a lot of money, I have to say. And again, the EU and the European Commission, the European Parliament and the Member States agreed to make sure at least 37 of those funds, of those 723 billion euros, has to be dedicated also and support climate action. So really a lot of money, but again, so that it really does support everybody, so people, really, individuals, and so this proportionate kind of approach to that, while targeting or providing extra support to those who can't afford, who would be otherwise left behind. The research and innovation at the EU level is also quite helpful, I have to say, with the EU missions and Horizon Europe now, with a lot of money as well. And some of the mission areas that we've been trying to propose projects under and then implement them. Most importantly, the one dedicated to climate change and societal transformation, but also climate neutral and smart cities, and cancer, as in focusing on the underlying determinants of cancer, relying on the unsustainable and unhealthy lifestyles to a degree, but again, taking it a bit out of the box of this kind of narrow focus. And I'm almost done, so we can open the discussion for, the floor for questions. Just very, very, very recently, actually a couple of days ago, a new social climate fund has been adopted by the European Commission and the Council of the Member States, which offers 59 billion euros. In a way, a lot. It sounds like a lot, but Not as much when you kind of divide it by all the people living in the EU and also the years that it has to be applied from the 2027 to 2032. So a bit perhaps too little too late, but yeah, to be seen if it can be expanded a bit. But what's interesting is the fund is to address, among others, the impact of rising energy costs on vulnerable citizens. And the member states will have to produce national action plans to this avail. Last year, a new European Observatory on Health and Climate Change was launched, and together with the European Environmental Agency, both of those institutions are increasingly more active on climate health and the equity dimension, so the vulnerable groups, which is quite a welcome step, I have to say. And it's also good to see the EU, but they have to be pushed a bit more to that, to take on the right to a healthy environment. So working within the human rights frameworks, specifically if it has to do with children and marginalized populations, the Roma, homeless people, refugees now. So I think that's kind of window of opportunity, really. And with regards to the economy of well-being, this is what we've been working with in trying to interest the EU level in taking on, hopping on the wagon, I'd say. The 2019 Finnish presidency conclusions on the economy of well-being were quite a surprising, I have to say, and welcome step. And ever since, we've been referring back to those conclusions and calling or reiterating the calls of the conclusions to be finally acted on. There's been a EU-wide foresight network at the EU level, which includes network of ministers for the future, which is quite a new a body under the mandate or kind of surveillance or guidance of the Vice President of the European Commission, Šefčovič. And for example, this year, also like last week, they launched and they produced a 2022 strategic foresight report, in which actually they admit that looking into revamping, reviewing the EU economic model, which is based on well-being, sustainability and circularity, will be the key for the years to come. So we are certainly going to follow up on that with Commission's President ahead of her State of the Union speech, so that it's reflected in the next year Commission's work program. And we've been working with the European Pillar of Social Rights and the principles that are under it as a kind of compass towards moving towards a social Europe, and working with the Social and Resilience Scoreboard, so a set of indicators towards that. But more has to be done to really reflect the measuring the well-being and so that everybody's taken on board in the green transition. Digital transition is also an issue. And also acting on the conclusions of the Conference on the Future of Europe, because these were produced as well, and perhaps not really taken into account yet by the EU level policymakers and the national policymakers as well. And an interesting initiative from the WHO European region, Economy of Wellbeing initiative, and also how it plays into the Geneva Charter for Wellbeing. So kind of slightly bigger than the EU only, but it's all kind of mutually reinforcing each other. And last but not least here, I have to say that sadly, the economy of well-being and this kind of wider health promotion, preventive, transformative approaches are not or have not yet found their way into the European Health Union package, which is still predominantly focused on the biomedical approaches, pandemic preparedness, crisis management, etc., and also not really in the EU for Health program. So this huge new program with a lot of money. Every year we see, 700 million, 800 million being put towards kind of, in our view, business as usual, although there might be something emerging in the years to come, hopefully, with the advocacy from EuroHealthNet and organizations like ourselves here in Brussels and across Europe. And I have to say as well, because this is what we've been working with, it hasn't also yet found its way in a narrative of the European semester process and the recovery plans, the implementation of the plans that the member states put forward, and that was accepted by the European Commission, in how they support the reforms of the health and social protection systems, for example, to be more supportive to health equity, well-being of people, and the environment. Just before I show you an interesting video to conclude my presentation, just to kind of wrap it up, what we want to see is moving from ego and solutions that focus on now to eco and solutions that focus on forward, from repair and deficits to prevention and assets, from silo thinking to system thinking, from individual lifestyle focus to healthy and sustainable living environments and caring communities, from fragmented budgets to joint budgeting and programming, from the GDP growth-led economy to economy based on well-being and working for the well-being and for the people, and from currently EU semester of economic surveillance to EU semester of social resilience surveillance. So really to make sure that what the Commission put forward back in 2019 is an economy that works for people and is based on the social fairness and prosperity. And just to conclude, very short 1.5 minute video, which illustrates, I think better maybe than I do, what we are trying to do with the economy of well-being for health equity narrative. And then I'm open for any questions and discussion. Yeah, hopefully you will hear it.
Unsustainable economic growth is contributing to crises such as climate breakdown, COVID-19, health inequalities, and a rise in chronic diseases. Additionally, conflict and humanitarian crises are causing catastrophic suffering. They also create spillover effects that harm the global community. We must act in solidarity. We must offer alternative models and work toward an economy of well-being which benefits people and the planet, built on valuing things such as peace and security, healthy food, decent income, mental health, green spaces, and community and care. In an economy of well-being, indicators of well-being are as important as traditional economic indicators, where health systems don't only cure illness, but prevent it, helping people to thrive throughout the life course. We are at a crossing point. Now is the time to make structural and sustainable changes to our societies and to redesign our economies to strengthen social justice, health, and well-being. The Economy of Wellbeing model offers a blueprint to help make those changes. Across Europe and the world, people are taking action. Tools are available to help you do the same. The EuroHealthNet partnership is contributing to this shared vision. Contact us to learn how we can support an economy of well-being together.
Okay, so that was it. Thank you so much. You can see my contact details here at the last slide, but I'm sure these will be also shared by the organizers of the event. And yeah, thank you so much.